everyone. Welcome to the UM Breakfast seminar. We have, for the first sections, we have our Associate Professor, Dr. Ong Kian Chai, with us today. So he will present, I think, his research work, the antiviral properties of medical mushroom. Please, um, he he this is part of his research work in HMD. So please welcome Dr. Ong for the presentation.
Thank you, Dr. Tan, and very good morning to everyone. Today, I'm going to share with everyone some of the research works that we've done by our team. It's mainly on study on medicinal mushrooms. It's called Ganoderma neojaponicum himazaki, that against have antiviral activities on certain enteroviruses. Of course, everyone may be aware that enteroviruses actually contain a lot of members. So in this case, our focus is just on enteroviruses that mainly cause hand foot mouth disease. So basically, the content of my presentations basically will involve what would be the what is HMD and their clinical symptoms, the viruses that cause them, some latest epidemiological data, then followed by some brief descriptions about the mushrooms, its properties, and so on. Then followed by some of the works that we have tested, in this case, to how do we find out that these medicinal mushrooms contain antiviral activities. Okay, so let me share my screen first. If anyone cannot hear what I'm saying, please let me know. Thank you very much. Okay. Again, today my topics will be on medicine mushroom with anti-enterovirus activity. I actually from Department of Biomedical Science, Faculty of Medicine, UST Malaya. Okay, first of all, what is hand foot mouth disease? Actually, hand foot mouth disease is a childhood illness. I'm sure maybe everyone may not be not familiar with this disease because it's usually occur in children less than 5 years old, and it's caused by enteroviruses. Of course, there's several enteroviruses that will be the main etiology agents for this disease. And the infection actually spread from persons to persons, usually with close contact through fluids, oral fluids, and through oral or fecal oral sometimes. And it's an important public health disease in Malaysia because it can cause large numbers of cases within a short period of time. And usually will cause, sometimes will cause death in among children and infants, especially those that's caused by this particular enterovirus called Enterovirus A71. Of course, this is a poster obtaining from the Positive Parenting program, mypositiveparenting.org. Basically, this explains what is HMDs and some of the symptoms. Basically, they have painful sore throat or sore in their mouth. So usually the children will have very poor appetites during that time and also have high fever and also lack of energies, and usually they will have skin rashes with red spots and sometimes with blisters on the palms and hands and on the buttocks and genital area. So what would be the enterovirus that usually cause HMD? Basically, typically is caused by enterovirus A71 and Coxsackie A16. They are the major cause so far. But recently we have seen that there's raised in other enteroviruses that are also able to cause HMD, in particular CAV6, Coxsackie virus A6. And the danger of this HMD, as mentioned in the early slides, is this sometimes can cause CNS complication, but this usually is quite rare, usually less than 1%. And if it's caused by, if the children suffering CNS complication, usually is due to, is caused by, infected by this particular enterovirus A71. And some of the complications of CNS complications that maybe the children will have will be like aseptic meningitis, acute flaccid paralysis, and encephalomyelitis. And how is HMD outbreaks in Malaysia, the current situation? So I have obtained some data from Ministry of Health. So this is basically showing that in 2023 until 13th of May, our country already recorded 9,822 cases. And of course, compared with last year, same period of time, is 31,622 cases. So it can, as you can see from this figure, actually is quite concerning that there is a very serious kind of public health disease. Although most people now are more afraid of COVID compared with HMD, but HMD actually also quite need to pay some attention as well. Okay, so and from last year, the main viruses that caused the outbreak will be these three viruses: CAV6, CAV16, and EVA71, and resulting two cases that the children had to be admitted to ICU with CNS complication, and it has been proven that these two children were infected by enterovirus A71. However, in 2023, the viruses that cause HMD is mainly these two viruses, CAV6 and CAV16. So because it's a public serious disease, so this is MySejahtera, the apps that we always use during the COVID pandemic's time. I'm not sure everyone still have these apps or not in your handphone, but now they also can trace, or they can give you some a lot of information about HMD as well. So basically they will tell you in your area, something like COVID as well, in your area, how many cases, how many reported cases for HMD. This actually gives some information for the parents that to avoid to bring their kids or to take certain precautions before the outbreak strikes, or the children will get exposed to the viruses. So how about the vaccines and any antiviral agents available for this disease? Currently, there's not available. I mean, not available in the sense that not available that can tackle CAV16, CAV6, enterovirus A71, and CAV10, all these four viruses. However, there's three inactivated vaccines that have been currently used and licensed in China, but this vaccine is not available in Malaysia or in other countries. And however, these vaccines only confer protections against enterovirus A71, but not other enteroviruses. So it can tackle enterovirus A71. Maybe it can prevent CNS complication as seen in China, but however, it cannot prevent HMDs that are caused by other enteroviruses. Hence, having a broad spectrum antiviral agent or broad spectrum vaccines for these HMDs will be needed to control the disease transmissions and its complication as well. So this actually PowerPoint shows some clinical symptoms. They will have some vesicles or rashes that show on the children's near to their oral, near to their mouth, and sometimes they have ulcer in their tongue and so on. This is usually caused by Coxsackie virus A16 or enterovirus A71. And this looks more severe and more widespread, the skin lesions. This is caused by Coxsackie virus A6. So Coxsackie virus A6, in terms of its clinical presentations, is a bit different compared with CAV16 and enterovirus A71. Of course, the reasons behind is still unclear. So now I'm going to share with everyone what, in general, how the virus replicates. Why we need to know viral replication cycles, because in order to control or to develop some antiviral agent against these viruses, so it's good to know how they replicate so that you can design some drugs or some agents that can target certain step of replication or certain replication steps that the virus is going through before they were able to complete their life cycles in this case. So as say, you must know your enemy first before you can tackle them. So in general, for all viruses, they need to attach to a receptor that present on the cell surface before they can be uptaken into the cells. As you know, virus require live cells to replicate. They cannot infect that cells. They cannot replicate outside the cells. They need to be replicating inside the cells. Okay, because they use the host machinery to produce their components to form a mature virus later on. So to continue back with the replications. So once it's attached to the receptor, and sometimes they have a lot of attachment receptors that present on the cell surface. This will catch up, the virus will get attached to this receptor, and then sometimes they will get entry. If the receptor also serves as an entry receptor, then he's get enter in. After that, he will release his genome out. Okay, in this case, the virus is RNA virus, positive sense RNA virus. Positive sense means these genomes can, when enter the cells, it can serve like a mRNA, messenger RNA. They can directly translation. Translation means produce protein. So once they release into the RNA release, the genome release into the cytoplasm, it will start to translate and produce a polyproteins. And this polyprotein later will be processed to become individual capsid, or we call structural. Structural means that the build out of the virus, and then they have replication protein or non-structural proteins that involve in their genome replication, because they need to make more copies of their genomes to form new infectious viruses. And after that, the virus will get packing to form a mature virus, and the cells will get lysed so that the virus can release out and continue their replication cycles. Okay, then we move on to the medicine mushrooms that I just mentioned in the beginning of my talk. It's called Ganoderma neojaponica imazaki, and basically this is how it looks like, and it's usually consumed by the indigenous people in Malaysia as a remedy for diabetes. Some of the indigenous groups will be Tamoians and Tamites. And usually, there's some reports, some scientific reports that are conducted by some our professor researcher, is to study the preventions of high-fat diets cause diabetes, and also type 2 diabetes mellitus and associated metabolites abnormalities, and also have been reported to have genome protective and anti-inflammatory property. Genome protective means it can protect the DNA from getting damaged, and also have strong and good antioxidant activities, and also anti-cancer properties as well, not only those targeting metabolites diseases. And of course, if everyone's, I'm sure everyone's know about linzi. Linzi is also a Ganoderma mushrooms. And Ganoderma mushroom have been reported as one of the best known medicine mushroom fungal species. And the Lucidium actually is the most extensive investigated Ganoderma species so far. But however, this Ganoderma neojaponica imazaki antiviral property are still unknown compared with the other Ganoderma mushrooms. So that's why we are quite fortunate to have opportunities to investigate its antiviral activities. Okay, this slide showing that there's some antiviral results that we have published in Tropical Biomedicines, and this is actually involves several researchers and that from different areas, like Prof. Vicky will be a specialist experts in mushrooms to identify them. And Prof. Umar is a biochemistry experts, and Prof. Wong, Dr. Tan just now, the moderator is involved in pathology and virology, and Dr. Prof. Pereira from UniMass is actually contributing or supplying the viruses for us to test the agents. And mainly these works were performed by Ms. Ang, our PhD students. If anyone interested, please, you can go and have a read on this paper. Today, I just will summarize what we found. Most of the data is obtained from these publications. Okay, so the mushrooms that we use is actually the entire mushroom. So that's why we need to process it before we can apply on cell culture, because we could use in vitro systems. In vitro system means it's not using living live animals model or humans to test the antiviral activity. So in order to get the extract, so we use three different preparations methods. So we use double boiling, and we have also tried different boiling times. We have S1, which is 30 minutes boiling, and S2 is 3 hours boiling. And some of the mushrooms is also we immerse or we submerge in alcohol with different percentage to extract to see whether those extracts have any good antiviral or not. And this is the rotary evaporators that we use to evaporate the alcohol and subsequently become a dry powder. And then we can dilute them or make them soluble in culture media or in organic solvents to later on to be applied on cell culture. Of course, for the absolute alcohol one, which is S400%, because it's not water soluble, so that's why we only can dissolve them in organic solvents called DMSO. Okay, so before you can test, you need to have a model. Okay, in this case, so of course it's a cell model, cell line model. most people will use cancer cell line because it's easy to maintain, easy to grow. And in this case, we use a primary or referable blood cells that we obtain from infants. That of course we get ethics approval and consents from the parents. And this we have published in this paper, Pew et al. 2017. So these cells was shown to be highly susceptible to all the tested enteroviruses. Because the model that we choose had to be highly susceptible. If not, then it's impossible for us to test the efficiency or the efficacy of the substrates extracts that we are tested. And now come to the viruses that we use. We use 4 different enteroviruses. Of course, we use enterovirus AS71, and this is the passage number. Passage number means that how many times we have grown them in vitro or in cell line. Because as everyone aware that if you grow longer, the more passaging you go, the virus will tend to mutate. Mutation. So sometimes their character may not be the same as when they first isolated. So it means they have changed slightly. Like I mean, the good example will be the COVID now. They have many different variants, an example. So these viruses, all the viruses we obtained from Sarawak, Malaysia. So the years of isolation is from 2005 to 2006. And the disease range from an encephalitis to HMD. So A16, A10, and A6 is basically from HMD patients. And ensure A71 is from encephalitis patients. Okay, before we can begin the right dosage to be used to test the antiviral activity, firstly, we need to know the maximum non-toxic dose, because everything is toxic if everyone agree, even because it depends on the dosage that you use. The higher the dosage, of course, the toxic effect is higher. So that's why we need to use a non-toxic dose to be applied on cell. If not, the cells all get killed before it can be tested or can be infected by virus. So if the cells die, there's nothing we can do or nothing we can test really. That's why we need to find a dose that did not show cytotoxic activities on these oral fiber blood cells. So we have tested different concentrations, okay, in this case. And as you can see, the S4, which is this one, we use lower because the higher one actually shows cytotoxic. That's why we do not go up to 0.1 milligram per ml. And after we have gone this data, so we have decided to use 1.25 because the 1.25 milligram per ml treated cells does not show significant reduction in terms of cell viability and also its morphology. We also check the cells morphology, whether after treated with these extracts, they show any anomaly in terms of their morphology. If they show, may suggest they have some effect on them. Okay, then come to antivirus screening. So because we have 4 extracts, so because of limited resources, so we have to choose the best ones to continue. So before that, we need to test which ones contain the highest or strongest antiviral activity. So how we perform is, this is the cells. Firstly, we treated the extract into the cells, leave it for about 2 hours to 24 hours, then followed by virus infections. And any cells that show no morphological changes, we call no CPE, cytopathic effect, because once virus infects cells, it will kill the cells or cause the cells to change its morphology. Example, you look at this picture B. This is the well of cells that were infected by virus, and this is uninfected. So based on cytopathic effects, we will determine which extract show the highest protection level before we check their basic mechanisms, how they prevent infections. Is it blocking the viral attachment to the cell receptor? That's why we need to know how the virus achieves infection at the first place, or it inhibiting the virus replication when it's entered the host, or the extract itself has some effects on the cellular receptor or the cell receptor that the virus used before. The virus, means it can have effect or block the attachments of the receptor before the virus could attach to it. So the result have shown that S2 show the highest antiviral activity. That's why we just, the subsequent work is just mainly focused on S2. So to know their basic mechanism, so 3 antiviral experiments were performed. First will be pre-infection treatment, followed by post-infection treatment and virucidal. Pre-infection treatment is, it works like this way. Firstly, the cells will be treated by the extract. for 24 hours. After 24 hours, then followed by virus challenge or viral infection. This is to see whether we can prevent the virus from infecting the cells after if we pre-treat the cells first. The post-infection treatment is another way. We let the virus to infect the cells first, and at 24 hours post-infection, only we treat the cells with the extract. For virucidal is to see whether that compound can actually bind to the virus in this case, or have some effect to the virus particle and cause the virus particle not able to attach and gain entry into the cells later on. That's why we will pre-mix the virus and the extract together for 1 hour at 37. After 1 hour at 37, only we added this mixture into the cells, and then we observe for CPE. And also we will do a titration. Titration means we will quantitate the live virus productions from the treated versus untreated round. And the result shows that, as you can see in this figure 2, enterovirus S71 basically can be show good antiviral effect in the post-treatments and virucidal experiments. And CS16 show the same pattern, only show post-infection treatments, and CAV10 only have post-infection treatments, and CAV6 only post-infection treatments. So basically, this extract, this S2, have post-infection treatments, means that these extracts can limit the viral replications once the virus have entered and start replicating in the cells. But for EV71, it's a bit special. It can also inhibit its attachments to the cells receptor if you mix or you expose the S2 with the virus first. Okay, so in order to study its efficacy or efficiency of S2 against these 4 viruses, then we will do a time points investigations, because the previous one, this one is basically sometimes it's 2 hours after infection, then we start the treatment. So sometimes 2 hours after the treatments may not be so real in real situations. That's why we would like to start, or 24 hours and so on. So we would like to see how far or how efficient the S2 can still treat the cells if we let the infections for 48 hours post-infection up to 72 hours post-infection, and see whether we can still see viral reductions or not in the treated cells, in the infected and treated cells. As you can see in this figure, enterovirus S91 can be still inhibited up to 72 hours post-infections. CA16 also up to 72 hours post-infection, same as CAV10. However, CAV6 is a bit less efficient. On CAV6 is only efficient at 2 hours post-infections. Other time points will not significantly reduce in terms of the viral titer. Okay, so come to the discussions. Actually, developing effective and safe agents for HMD is challenging, because it can caused by different enteroviruses, as I just explained just now. So today, the main focus is on EVA71, because it can cause fatal outcome. So that's why a lot of researcher is mainly focused on EVA71. So, of course, it can prevent death and CNS complications, but however, a narrow spectrum antiviral agents will only be beneficial to a small portion of HMD patient. And you can see now in Malaysia this year, the most dominant antivirus that cause HMD is CAV6 and CAV16. So EVA71 is not seen. So that's why even you have the vaccine also, it may not be so useful here. So this highlight the importance of developing a spectrum antiviral agent, even vaccine, against antiviruses that cause HMD. So as shown in this study as well, different extractions methods will produce different antiviral activities. It's quite interesting findings. And of course, the double bonding is the most commonly methods that people use, because it's quite simple to be performed. Of course, but I think they also have disadvantage is you cannot, it's high energy consumptions, because you need to keep boiling the things for about 3 to 6 hours to get desired bioactive compounds released from the mushroom itself. And the antiviral bioactive compound may have a higher solubility in waters than organic solvent, as shown in the study as well. You can see those that is like we immerse in organic solvents, the antiviral activity actually is lower compared with the ones that in water. And this antiviral compound appears to be quite terminally stable, and it's not negatively affected during the heating process. So it's quite stable in this case, which does not get affected by the boiling process. And of course, shown in this study as well, is high effective in inhibiting EVA71 in both situations, post-infection and also virucidal. But however, it's less effective in inhibiting CAV6 replications. So further investigation are necessary to review the exact mechanism of antiviral actions of S2. This is still, I have to emphasize, this in vitro findings are very preliminary, and more studies need to be done to further understand and further study its limitations and other, and to further characterize these agents to further understand or further see whether they have any other beneficial activities that we have yet to be discovered. And also animal models need to be formed to actually provide more profound insight into efficacy of the extract, because this is a direct exposure, direct treatments. For in actual in vivo system, the condition will be different because you have to pass a lot of barrier before you reach its targets, and also the body will try to remove it before you have the effects, and also the stability when it's inside the body. So as a conclusions, this mushroom extract appears to be a potential candidate to be further characterized and developed into an effective, safe, and antiviral agent against enteroviruses that cause HMD and possible other medical important human viruses as well. So that's all for my study. Last but not least, I have acknowledgement to Jolie Trust Foundation UK for supporting the study, and also Dr. Long Fei. Thank you very much. These are the references that I used to prepare this presentation. Thank you.
Thank you, Associate Professor Dr. Ong. These are very informative presentations, and I guess everyone have shared and learns about how these antiviral drugs is being formulated in the future. So, due to the time constraints, I will just pick up the Q&A sections that have been written down in the chat box. So, Dr. T have a questions. Based on the statistics presented, EVA71 is circulating at a lower prevalence in 2023 versus 2022. Similarly, similar periodicity was also observed in previous year, but such information remains insufficient to provide sufficient resolutions to accurately predict the next wave of EVA71. Could you please explain such seasonal or cyclical behavior of EVA71 in the context of population's herd immunity? Sorry, you are muted.
Thank you, Dr. T, for the questions. Actually, I don't have maybe the correct answer for that, because I'm not very familiar with this epidemiological kind of data. But EVA71 have been seen as 3-year cycles kind of appearance to cause outbreaks and so on. So here, immunity basically, I think most of us, maybe most of our children, will have immunity to either one of the enteroviruses. So, but maybe it takes, because those children may have immunity already, maybe they have clinical infections, or they have asymptomatic infection and so on. But that's why maybe it's more prone to the newborns. That's why it may take some years to. It may take 3 years to have a new population that is more susceptible to a new virus or a circulating virus that's present during that time. So yes, I do agree that humanity able to maybe change or will affect the circulating type of enteroviruses that will cause the outbreak. But the reason behind them, I'm not very certain. I'm not very sure about this, because I'm not the area expert on these issues. Yeah. Thank you very much for the questions. I hope I answered partially your questions. Yeah.
Thank you. Due to the time constraints, we have to close the Q&A sections and pass to the next presenter. However, if you have any questions, please feel free to drop an email to Associate Professor Dr. Ong.
Please feel free to drop an email to me. I try my best to answer your question as soon as possible, as much as I can, within my area of knowledge. Thank you very much for everyone's questions. Sorry, not able to answer all.
Thank you, everyone. So I'll pass the floor to the next moderator.